Hello guys, welcome to Medicos lectures by Vibisha. Hope you are all doing well. Do you guys know about sexually transmitted disease? So today, we are going to discuss about sexually transmitted disease.
So before get into the topic, you have to do follow, share my video, and comment. And don't forget to turn on your notification symbol. So let us get into the video.
So, do you know anything about sexually transmitted disease?
Yeah, Emily. Let us discuss about sexually transmitted disease.
Okay, can you tell me about introduction?
Yeah, sure. So here's the introduction. Sexually transmitted disease are also called as STD, which are predominantly transmitted through sexual contact from an infected person.
So, is there any classification are there in STD?
Yeah. We are having 5 classification.
So, can you name the 5 classification of STD?
Yeah. Sure. They are syphilis, group of dots, gonorrhea, chlamydia, group of dots, herpes, and human papillomavirus. These are all the major 5 classification of sexually transmitted disease. And these are all the major one.
Now can you explain this one by one?
Yeah. I will explain one by one.
Okay, now explain me about syphilis.
Syphilis, it is caused by Treponema pallidum. So it spreads on both horizontally and vertically, group of dots.
So can you tell me how these bodies enter?
Entry of the bodies through the minute abrasion on the skin mucous membrane.
So what are all the causes of syphilis in secondary stage?
Flu like illness, mucocutaneous rash, multiple lymph, and they spread to liver, muscles, and skin. So the latent stage are it lasts for 3 to 50 years, and they do not produce any symptoms. So the tertiary stage that occurs in 30% on patients: neurosyphilis, cardiovascular syphilis, and gummatous.
So what about the treatment?
So treat with single dose of penicillin only in primary and secondary. Tertiary stage should be treated with antibiotics. And that's all about syphilis.
Okay, and what about gonorrhea?
Gonorrhea is caused by Neisseria gonorrhea, and it spreads both horizontal and vertical. It doesn't survive well outside of the body. Greater chance of a woman getting infection from a man.
What are all the site of infection?
Vaginal mucosis, urethral mucus of penis, mucus of the throat, and mucus of the rectum.
So what are all the clinical factors?
Incubation 2 to 7 days. Men can have discharge and dysuria. 10% can be asymptomatic if left. It bronchitis, prostatitis. Women can have vaginal dysuria. It can be diagnosed by gram-negative Diplococcus antibiogram carried out for positive culture. And that's all about gonorrhea.
Then chlamydia.
Chlamydia is subdividing to serotype, A to C sericide infection, D to K general infection, plus respiratory infection.
What about the clinical features?
Bacteria bind to specific receptor and enter via parasite-induced endocytosis. It can be cured by antibiotics. So lab investigation are urine sample, vaginal swab, cell culture. And that's all about chlamydia.
So now can see about herpes virus.
Herpes are 2 types. One is it cause cold sore, cause genital infection. It can be classified as Short replication cycle. Clinical features are: it will be around. Genital fever will be present. So the treatment are antiviral or laxaclavir. Thoughts all about herpes.
So now at last we can discuss about human papillomavirus.
HPV can cause genital warts and cancer. There are 120 distinct types of HPV.
So what about the clinical features?
Human papillomavirus can affect the genitals, anus, mouth, and throat. The warts type are small or group of bump, can be large or small, raised or flat, cauliflower in shape. It appears weeks to months. Treatment are cryosurgery. Thoughts all about sexually transmitted disease. I hope everyone understood about our today's discussion. And if you like this video, do like and subscribe to my channel Medicos Lectures. If you have any doubts regarding this, you can ask me in comment section. Bye bye guys, see you in another video.